The immune system is a system of biological structures and processes within an organism that protects against disease. The function of the lymphatic system includes the absorption of excess fluid and its return to the bloodstream, including its absorption of fat, and the immune system functions. These two systems aid to protect our body from pathogens. The lymphatic and immune systems are made up of 6 or more main structures which they share. These 6 structures include the thymus gland, bone marrow, the spleen, lymph nodes, lymphatic tissue, and the tonsils. Bone marrow is responsible for developing most of the defense cells. They migrate from the bone marrow into the bloodstream and reach other organs and tissues where they mature and specialize. Lymph nodes filter and clean the lymph fluid on its way to larger lymph vessels. The lymph finally travels to a vein called the superior vena cava, where it re-enters the bloodstream. The spleen, which is situated in the left upper abdomen beneath the diaphragm, stores certain defense cells that are released into the blood to get to organs. It also is responsible for moving red blood cells as well as platelets. The tonsils, due to their special position at the throat and palate, their defense cells come into contact with pathogens especially soon and can activate the immune system immediately. The thymus, located behind the breastbone and superior to the heart, is one of the most important glands in the body. Certain defense cells are differentiated in the thymus. T cells move throughout the body and constantly watch the surfaces of all cells until they change. They learn this unique ability in the thymus, and it's only active during puberty, and after which is slowly replaced by fat, which is called involution.
There are 6 different types of white blood cells in the immune system: neutrophils, basophils, eosinophils, lymphocytes, monocytes, and macrophages. Neutrophil mediates immune responses against infections. It is also the most abundant of the white blood cells. Basophil contains histamine and has to deal with allergic reactions. Eosinophil also has to deal with allergic reactions and inflammatory responses. The next one is lymphocytes. Lymphocytes is a small white blood cell that plays a large role in defending the body against disease. The 2 main types are known as B cells and T cells. B cells produce antibodies that attack foreign molecules, and T cells attack the body's own cells when they are diseased. Whenever there is chronic inflammation in the body, lymphocytes are present.
Monocytes. They are white blood cells that help other white blood cells to remove dead or damaged tissues. They are produced in the bone marrow. When they enter the bloodstream, that's when they account for about 1 to 10% of the leukocytes. After a few have migrated to the tissue, such as the spleen, liver, lung, and bone marrow, there's an increased number of monocytes in the blood where it occurs to respond to infections, in blood disorders, and in cancers. There are 3 different types of monocytes. There's classical monocytes, there's non-classical monocytes, there's intermediate monocytes. They are the largest type of blood cells. Macrophages. When activated, monocytes turn into macrophages. They are important cells of the immune system that are formed in response to an infection. They can modify themselves to fight various different invaders. They survive for months at a time. Each of the macrophages have specific protein markers on their surfaces.
Autoimmune diseases occur when the T cells cannot tell the difference between healthy cells and antigens, causing them to set off a reaction within the immune system.
Leukemia. The immune system protects the body from possibly harmful substance by recognizing and responding to antigens. Antigens are substances, usually proteins, on the surface of cells, viruses, fungi, or bacteria. Non-living substances, such as toxins, chemicals, drugs, and foreign particles, can also be antigens. Symptoms of leukemia is weight loss, fever, loss of appetite, shortness of breath, swelling in the throat area, and pain and tenderness in bones and joints.
Neutropenia is a low count of neutrophils white blood cells, and the causes are a problem in the production of neutrophils in the bone marrow, infections which disrupt bone marrow function like HIV and malaria. When you take in too many antibiotics, nutritional deficiency, and also when you take in too much drugs. There are 4 types of neutropenia. The first one is cyclic, which is present at birth and varies in a 21-day cycle. And that's when white blood cells fall from normal to low, and that lasts a few days, and then they go back to normal and the cycle starts again. Another one is autoimmune, which develops later in life, and the body makes antibodies that fight neutrophils, and these antibodies kill the neutrophils. Another one is idiopathic, which also develops later in life and can affect anyone, and its cause is unknown. And the last one is congenital, which is present at birth, and it's a Costman syndrome. The immune system defends your body from domestic and foreign threats. Some facts about the immune system are people who lack humor in their lives tend to have a less protective immune system, and too much cleanness can actually let bacteria into your wounds, and so that'll also affect it. And some people are actually born with no immune system. Treatments for neutropenia depends on the cause and severity. You can take antibiotics for a bacterial infection, drugs to suppress the immune system, and you can treat an underlying infection if it's causing the problem. You can take in vitamins and granulocyte, and mild cases may not need treatment. Preventions for neutropenia is to have good hygiene, like dental care and washing your hands, and always wearing shoes, and cleaning your cuts and scrapes and covering them with bandages, and avoid unpasteurized dairy foods and undercooked meat.
Another immune disease is psoriasis. Psoriasis is a common immune mediated disease characterized by skin lesions including red, scaly patches, and plaque, which is usually itchy. Psoriasis develops when the immune system makes a normal skin cell for a pathogen and sends out faulty signals that cause overproduction of new skin cells. When you have psoriasis, T cells mistakenly identify your skin cells as other and attack them. This attack injures the skin cells, setting off a cascade of responses in your immune system and in your skin, resulting in skin damage. In an effort to heal, your skin cells begin reproducing rapidly. Large number of new skin cells push their way up to the surface of your skin. This occurs so quickly that older skin cells and white blood cells aren't shed quickly enough. These discarded cells pile up on the surface of the skin, creating thick red plaques with silvery scales on the surface. The causes of psoriasis are not fully understood, and there is no cure, but various treatments can help control the symptoms.
Type 1 diabetes is when the immune system cells destroy cells in your pancreas called beta cells. These cells produce insulin, and insulin is a hormone that helps move sugars and starches into your body's tissues. This can lead to dehydration, weight loss, and diabetic ketoacidosis. Diabetic ketoacidosis occurs when too much glucose in the blood is present, which means there is not enough energy being burned as sugar. The body breaks down fat cells in return, causing the release of ketones. Too much of these can make your blood toxic and can even kill you. This type of diabetes is rare, occurring in only 5% of diabetics. Doctors do not understand why it occurs, but they believe it is a genetic condition. Some conditions include heavy thirst, increased hunger, especially after eating, dry mouth, nausea and vomiting, pain in your abdomen, frequent urination, unexplained weight loss even though you're eating, fatigue, blurred vision, heavy labored breathing, or frequent infections of skin. To diagnose type 1 diabetes, doctors will measure your blood sugar level or test your urine for glucose. After diagnosis, patients should aim to keep their blood sugar level between the doctor's suggested range. All patients must also inject insulin to control their blood sugar level. Type 1 diabetes sufferers must also watch their ketone levels as well. This is an easy way to indicate high blood sugar. Working out is similar, where the amount of glucose being released is exceptionally high to compensate for the labor. Before you work out, make sure you check your blood sugar levels.